Well, good afternoon, everyone, and I just want to extend a warm welcome on behalf of NMA that all of you came to this discussion. It really means a lot. I'm Lynn Bozoff. I'm president of the National Meningitis Association. And as a parent, I died from bacterial meningitis, a vaccine-preventable disease. And as a grandmother to 3 little ones, getting kids vaccinated is a really important subject for me. So today's discussion will address critical national issues that challenge vaccine success in the United States. Although at present we mostly focus on adolescent vaccines, early childhood vaccines lay the framework for vaccine success throughout the lifespan, from infancy to adult immunization. And while today's focus is on these early childhood vaccines, I still need to mention the challenges that we're facing with adolescent vaccines, and I am sure they will all be addressing that. So we're very excited that for the primary dose of the MenCYW, for 11, 12 years old, it's up to 78%, but we'd like it even higher. And for the booster dose, for the coverage at age 16, it's less than 30%. So we want every adolescent protected against this disease, not just 8 and 10 at age 11 and 12, or 3 and 10 when they're hitting 16 and hitting their most vulnerable years. And of course, we care passionately about serogroup B vaccines, and we all know the uptake of that is very low. And HPV is another huge concern. Only 26% of girls and 16% of boys are fully vaccinated. So this is a vaccine that protects against cancer. And once teens come into contact with the virus, it's too late. Now, we're all parents. We don't want to think of our kids needing, an HPV vaccine, but they're kids, and they will be exposed to the human papillomavirus at some point. So our job is to keep them safe, and this vaccine does that. With that, let me introduce the terrific panel that we have here. Their bios are in the handout that you have, so I'm just going to give you a brief sentence or two about them. So Dr. Carol Baker is a pediatric infectious disease expert from Baylor College of Medicine in Houston. She's worked extensively in the area of vaccine policy and just finished her term as chair of the CDC's Advisory Committee on Immunization Practices. And Dr. Baker really works tirelessly for the health of our children. And Arthur Kaplan is professor of medical ethics at NYU Langone Medical Center, and he's best known to peers and the public for assessing moral issues connected to medical interventions, and this includes vaccination. Dr. Paul Offit, on the end, is director of the Vaccine Education Center at the Children's Hospital of Philadelphia. He's co-inventor of the rotavirus vaccine and a best-selling author. He's written several books about vaccines, the anti-vaccine movement, and junk science. And we all know who's responsible for some of that junk science. And Dorrit Rubenstein-Rice is a professor of law at the UC Hastings College of Law, and she specializes in legal issues related to vaccination, such as exemption laws and who bears the burden of cost for disease outbreaks linked to those who haven't vaccinated their children. Allison, there, is the president of the Autism Science Foundation. She's a lifelong advocate for raising awareness about autism spectrum disorders. She's a mother of a daughter with autism and has a brother with autism. So Allison resigned her position from another autism advocacy group several years ago when they wanted to spend more money trying to connect the dots between vaccinations and autism. At the time she said, we don't have an unlimited pot of money, and every dollar spent looking for where we know the answer isn't, is money taken away from where we really should be focusing. And she said that vaccines save lives, they don't cause autism. And Dr. William Schaffner is a preventive medicine and infectious disease specialist at Vanderbilt University School of Medicine and the medical director of the National Foundation for Infectious Diseases. He is particularly skilled at breaking down health science and making it understandable to everyone. He's often called on by the media and treats every media request as an opportunity to learn. He's really a great educator about vaccines. And we're hoping to be joined soon, assuming his plane lands on time, by Dr. Mark Siegel, an internist and associate professor of medicine at NYU Langone Medical Center. He serves as Fox News medical correspondent and a columnist for several news outlets, including the New York Post and Forbes. And finally, we're delighted to have Paul Lee, a pediatric infectious disease specialist at Winthrop University Hospital in Long Island, as our moderator. Dr. Lee has been a long-time supporter of NMA and just has helped us so much and works tirelessly also to make sure that all kids are fully immunized. And as I previously mentioned, our goal is to address critical issues that hinder childhood vaccine success in the United States. And this may include some hot button topics, at least for me, such as parents who opt out of vaccine requirements, physicians who don't stick to the schedule, and the role of the media. So with the exception of a few brief opening remarks from Dr. Lee, there will be no formal presentations. Dr. Lee will pose a series of questions to the panelists who will each answer from their professional perspective. And we've set aside 30 minutes at the end for questions and answers, and we encourage you to speak up. So we are also live streaming this event on our Facebook page. So in the spirit of sharing, should you be posting about this event to any of your social media accounts, please use the hashtag #YesVaxChat. So now I'm going to turn this over to Dr. Lee.
Thank you, Lynn. So in medicine, we're constantly moving forward. We're trying to uncover the causes of diseases and finding new treatments, cures, and really trying to make life better for everybody out there. But unfortunately, especially in area of childhood vaccine preventable diseases, we've had some setbacks. Vaccines really have been one of the greatest medical contributions, probably one of the greatest scientific contributions, probably the best thing that's happened to mankind ever. If you just want to talk about a very short period of time, within the last 20 years, between 1994 and 2013, immunizations in kids probably prevented about 322 million illnesses, about maybe 750,000 deaths, and saved nearly $1.4 trillion in health costs. So that's a pretty impressive time just for a 19-year period. Vaccines have gotten rid of smallpox. They've almost eradicated polio from this planet, and they've really had a major impact on a lot of diseases out there. I mean, probably many of us grew up knowing about chickenpox, but if you talk to people nowadays, when was the last time we actually saw somebody that had chickenpox? So these vaccines really have an impact, even when they've occurred and being given quite recently. But however, there's also been, as we've started giving these vaccines, a pushback and a lot of anti-vaccine sentiment. And this goes back even back to the 1800s when the smallpox vaccine became sort of mandated. And if you actually look, there was this went all the way to the Supreme Court, Jacobson versus Massachusetts in 1905, where a parent claimed that he and his son had a bad reaction to the smallpox vaccine and they didn't want it. So even though this has been sort of a historic kind of thing, the anti-vaccine movement, maybe and possibly because of the rise in social media and the ability of everybody to kind of post their opinions and really get that word out there, has really possibly contributed to this resurgence in diseases that were previously well controlled. What are some of the other factors? The problem is that vaccines are probably the victims of their own success. I mean, again, here in the US, how often do we see measles nowadays? If you talk to your grandparents, great-grandparents, measles was a common part of their lives. We talked to measles, even probably from many people on the panel here, within the last 10, 20 years, how many cases of measles? You could probably count the number of cases on one hand that we actually see nowadays. It feels like history. It feels like something that happens somewhere else. It feels like almost fiction, that it just doesn't happen here in the US. So if you don't perceive any kind of risk, why do you want to get the vaccine? We know that there are low rates, as Lynn had mentioned, for the HPV vaccine. And we know there are certain reasons, because it's a sex vaccine and my child's not having sex. And my response to that is often, yeah, and those parents on those Girls Gone Wild videos didn't think that their daughter was going to show up in that box cover. Or the other way to think about it is, what were you doing as a teenager that your parents never found out about? So if you think you know everything that's going on with your kids, you thought you were smarter than your parents, and I know my child thinks that she's smarter than me. But the risk of HPV is a reality, and we know that is a serious disease. And again, parents are weighing these perceived risks versus the potential benefit of this cancer-preventing vaccine. And of course, flu. When you go to the flu, when you go to your doctor, the doctor asks you, do you want a flu shot? No, that's like asking, do you want to get kicked in the head? If you have a choice of between getting a flu shot, why is it being offered to you? Most of the other shots you just get. You need your tetanus booster. Okay, it's not like, hey, would you like this? We need to really be kind of firmer about this, because it is a standing recommendation. It is recommended for children from 6 months to 18 years of age. So it's not really an option, it's a recommendation. And we are good with it. We know that the infants get the vaccines. We know every year we see the news clips of the elderly standing in line, 65 and up, getting their flu vaccines. In between, it really is that sort of bell-shaped curve and down here. So less than 50% of adolescents 13 to 17 get that flu vaccine, even though it is a recommendation. And then finally, we do know that as people travel through the world, we are starting to see other illnesses appear. They do travel, anybody can say Zika. But we do know that obviously there's no vaccine for Zika, but there are illnesses in other areas of the world where they don't have the benefit of widespread vaccination programs that allow access and for children and adults to get protection. So travelers who travel to these areas may actually pick up these illnesses and bring them back to the United States. We also know, unfortunately, there are other contributing factors that may lead to this kind of anti-vaccine sentiment. There are celebrities, they don't understand the science or the scientific process, but they feel like they can comment on, vaccines, and they can weigh in on, the credibility of discredited physicians. I won't name any names, Andrew Wakefield, but they prefer to rely on their anecdotes and their non-science as opposed to the facts. I don't tell them how I think that their performance in that latest blockbuster was, should have been, you should have done this differently. They probably wouldn't listen to me, but yet they feel free to comment on what I do for a living. And despite, the fact that maybe I did have a little bit more medical training, they are equally, credible, and their opinion should count as much as mine in terms of the safety and efficacy of these vaccines. We know that physicians are supposed to support vaccines, but then there are also alternative vaccine schedules that are promoted. And some doctors are, again, it's difficult when parents are giving such pushback. Sometimes, you kind of have to say, all right, maybe I'll give the vaccines on a slightly different schedule. I'll play along with the parent just to kind of make them happy. That's not really how things should work. If you were getting chemotherapy, you wouldn't start arguing with your oncologist. I don't really like that. Can we do this a little bit differently? I don't think any of us would feel comfortable, telling the person who's taking care of our heart medication, taking care of a critically ill, parent or grandparent, how to manage that practice. And yet, we do feel comfortable kind of saying, I just don't feel right about this vaccine. Why can't we do it differently? Even presidential candidates have weighed in on this issue. We know that, I guess if I'm going to talk about the two local candidates, so we know that Hillary weighed in saying the science is clear, the earth is round, the sky is blue, and vaccines work. Hashtag vaccines work. Let's protect all our kids, and a nice little hashtag, grandmothers know best. But sometimes they get it wrong. We'll talk about the other candidate from this state, who I won't name, but he does have a tower on Fifth Avenue just down the block. Healthy young child goes to doctor, gets pumped with massive shots of many vaccines, doesn't feel good, and changes. And all in caps, so somebody should tell them not to yell. Autism, many such cases. So I'm not telling you how to vote in November, but just bear that in mind. But it is challenging for parents when they're hearing all of this, especially on social media, and it's hard for them to really know where they're going to get that information. But they are getting information, from Jenny McCarthy, reality TV star, Andrew Wakefield, discredited physician, and Donald Trump. So today, what we're hoping to do is address the issues that are preventing the U.S. from achieving full childhood immunization success. According to the CDC research, there are many reasons parents give for vaccine hesitancy, despite this overwhelming and consistent scientific evidence that vaccines are safe and effective. There's just so much of it out there, and yet people continue to hold back on it, just like they continue to believe that Michael Jackson is alive, that JFK is alive, that Bigfoot is somewhere out there, and that they're all working on these vaccines that are harmful to kids. So hopefully, I think many of us on this panel, as well as ourselves, will have thoughts on how to respond to this. So since I've kind of spoken at length about this, I guess I'm going to turn it over to the panel now, and maybe I'll start by asking Allison Singer, do groups and individuals who believe that vaccines cause more harm than good have an impact on vaccine compliance in this country?
Oh, absolutely. I mean, I just want to start off by saying that the parents who believe that their children's autism was caused by vaccines are not bad parents or stupid parents. They're parents who love their children and whose children have now been diagnosed with autism and are going to face challenges for the rest of their lives. The whole family is going to face challenges for the rest of their lives. And so it's very natural, I think, for them to want to blame someone or something, in this case the vaccines, which are an overt hostile act that you have to perform on your child, for the fact that their children are going to spend their life challenged by autism. But what we try to tell parents is that you cannot be so overwhelmed by anger and grief that you lose sight of what the science clearly shows. And the science on vaccines and autism is very clear. There are now dozens of studies looking at vaccines and MMR and autism, thimerosal and autism. We've looked at children who have no vaccinations, some vaccinations, vaccination according to CDC schedule. There's no difference in the rate of autism. We've done studies looking at the younger siblings of children who have autism from whom vaccines were withheld. So this is a non-vaccinated group. And there's no difference in the rate of autism in that non-vaccinated group compared to a vaccinated group. So the science is very clear. And the message that we are constantly bringing to our families is to please not withhold life-saving vaccines from their children and from their subsequent children, because when you withhold vaccines, you do absolutely nothing to reduce the risk of autism, but you are absolutely increasing the risk that that child could contract and potentially die from a vaccine-preventable disease.
Does anyone else on the panel have any comments or additions?
So these are parents who are looking for understanding, right? This is a calamitous event. It's still a mysterious illness in the sense that medical science can't provide them an answer, and they seek an answer, and usually, obviously, they're looking for an externality. Well, they don't like to look within themselves, and one of the uncomfortable things is that contemporary autism research actually talks more and more about intrauterine events and genetic predispositions, not as though that were the complete answer, and that makes even looking at the contemporary science for many of these parents, quite understandably, even more uncomfortable.
what, I would also, we're compelled by anecdote. I mean, we're always looking for causes for things. So, I mean, I'll tell the story, but you probably all heard it, is the true story. My wife was helping the nurse give vaccines on a Saturday morning, and there was a 4-month-old sitting on her mother's lap. While my wife was drawing that vaccine up into a syringe, the 4-month-old had a seizure and went on to have a permanent seizure disorder, and actually at age 5 died of what was a crippling chronic neurological illness. Now, if she had given that vaccine 5 minutes earlier, there's no amount of statistical data in the world that would have convinced that mother of anything other than the vaccine that caused it. What do you think, I'm stupid? My child comes in, gets a vaccine, 5 minutes later has a seizure, and now has a permanent seizure disorder? I know what I saw. That's what you're up against. You're up against trying to convince people out of what is an intense emotional experience with statistics. It's hard.
I also think that we're challenged because of the way science and scientists speak. So, for example, scientists cannot say vaccines don't cause autism. You'll never have a study that shows that something does not cause something else. All you can talk about is the preponderance of the evidence. And so a lot of families say, show me the study that shows that vaccines don't cause autism. And our inability to show that study is cause for discomfort. I think the good news is that the science in autism is advancing to the point that we really are learning what the causes are. And I think that will help enormously, because so many parents also say, you can't tell me that vaccines don't cause autism unless you can tell me what does cause autism. And so our foundation and others have been investing in the science to try to understand the causes of autism. And we are learning more and more about the genes, the genetic duplications and deletions that are at the biomedical root of autism, and creating animal models and developing treatments that are targeting the genetic causes of autism. And I think that will go a long way. We used to think that once we had studies showing that there was no relationship between MMR or thimerosal and autism, that would be enough. But clearly that is not enough. I think what it's going to take are studies that really show with certainty what the causes are. And we are getting closer.
Art, let me ask you something. Apropos of all this, if you put all the studies together, would you feel uncomfortable if I or anyone else said, by now, I'm very certain that vaccines are not associated with autism? Vaccines don't cause autism.
No, I think,
to be more explicit, certainly in speaking to lay audiences.
No, I think the evidence
Would I be an
supports
ethically
the
bad boy if I
claim.
did that?
No, and I'd
Evidence
say
supports
the
the
burden is now on those who want to show the connection to come up with evidence, rather than conversely, where good efforts have been made again and again and again with no connection. So no, it wouldn't bother me. And I think in the battle in the public arena, this isn't a fight about statistical significance. It's a fight about who's going to capture the ears of the doubters and the hesitators. And I think in that war, one has to say not just the bulk of the evidence, the preponderance of the evidence. I think you have to say there's no link.
Yeah, that's exactly, Allison's point is the right one. The scientific method, in the scientific method, you formulate a hypothesis, and that hypothesis is the null hypothesis. You can either reject it or not reject it. You can't accept it, which is to say you can never prove never, which is to say you can never really say MMR doesn't cause autism. But frankly, when you get in front of the media, you better get used to saying it, because otherwise people hear a door being left open when a door shouldn't be left open.
Right.
I mean, you can't prove that Coca-Cola doesn't cause autism either, but we just don't happen to be having that particular fight yet. So, you're sort of, you're in a debate.
Someone's going to tweet that.
You're in a debate, and, you got to fight unfair. It's a debate.
I think you can fairly say that after scientists looked and looked and looked throughout the world everywhere and didn't find it, it's probably not there. It's not. We're not in a situation where it hasn't been looked at.
See, I wouldn't even say probably not there. I would just say not there. You leave that door open and people run through it.
And Dorit, I think that that's a very important thing to say, that this is a question that has been looked at now by scientists in many countries around the world, each of them doing independent studies, and they all come out with the same answer. Hello?
It's robust.
I think it's also, that point is also important when you come up across a claim that we're not listening to parents making the story, telling the stories. Yes, the stories were listened to, taken seriously enough for millions of research dollars to be invested, for studies to be done again and again and again. They just aren't supported by the studies.
So one other comment here, just to depress us all today further. Marco Rubio, remember him? Tweeted out today that there's a fight on, some of you know, at the FDA about the Duchenne muscular dystrophy drug made by Sarepta. And he said the FDA should pay attention to parents' statements, not the evidence. So part of the war becomes, when you're in the celebrity battles or in other places, we have leaders who are sort of saying, you know, put testimonials or parental observation ahead of scientific method. There is a weakness out there in terms of who's going to say, don't listen to parents. I mean, that sounds cruel. Don't listen to your mother. You know, it was just Mother's Day. I'm supposed to listen to my mother. But I think in these discussions, maybe Dorrit said it well, you know, you have an opportunity to trigger a question when somebody says, I see evidence of that, but then you examine it under the science. But there are plenty of folks out there who are arguing I'd rather listen to parents than scientists.
Well, why do we separate parents from scientists? Scientists are parents. It always drives me crazy when people will say, well, the CDC is covering it up and they know that vaccines cause autism. I say, well, you know what? They vaccinate their children. The doctors who work there are all, their children are all vaccinated. If they knew that autism caused vaccines, do you think that they would vaccinate their own children? So this issue of separating parents from scientists, I think, is something that we have to fight against, that scientists are parents.
But I'd like to reinforce your comment. As we listen to parents, those anecdotes serve to raise questions, but you may not draw conclusions from them. Once the questions are raised, then we can establish the studies that test whether the questions are valid, right? And so the autism issue was exactly such a question. It's now been addressed scientifically many, many, many times, and the answer has always been no association. It can be demonstrated.
And yet we have Robert De Niro, who announces that he's not saying that vaccines cause autism, he's just suggesting that someone do some research and see. And you just want to shake him because we've been doing research now.
Hug him.
No, not really. So, you know, how can we do a better job of letting the public know that this research has been done?
So, Carol?
I'm not allowed to speak. I grew up in California. Now, I want to get back to what Allison said, that parents love their children. I spend half my time taking care of children of all ages. And by the way, you haven't heard, childhood goes to age 25. That's right. The Society for Adolescent Medicine has decided to claim them until they're 25. That may be of interest to you. Parents do love their children, with rare exceptions. And many of those parents have mental health issues. So, how many of you who are female are mothers? Do you remember when you were taking care of your little helpless baby, and then your infant, then your toddler, who fell or had something, an illness? And what was the first thing you thought? What should I have done to make this not happen? And fathers do this too, but mothers are the worst. So when you're talking to a family, and it's usually mom, but it can be both, or dad, you need to start out giving them a break. And if they say, I don't want flu vaccine because who cares what the because? You need to stop and take the time. And I'm going to be critical of my physician colleagues who I love and adore and admire. We take less and less time helping parents make the right decisions. So HPV, I was on a panel with HPV, And there were many other physicians asked about it, and I said, keep it simple. Keep the message simple. This is a cancer vaccine. The end. Pediatricians don't want to talk about sex. I didn't either. After running a STD clinic for a month at Los Angeles County as an intern, I never wanted to talk about sex again in my life. So you don't need to talk about sex. You don't need to go there, you know? Today you're getting 3 vaccines. You're getting the one for the whooping cough, you're getting the one for meningitis, and you're getting the one for cancer. And Paul said, don't offer it. Well, it's up to your mother. It's up to your parents. Just give it. And I think that doctors bear part of this blame. There are a small proportion of people. I don't know how it is elsewhere, but in Texas we now have the parents who and this is a big part, we want things to be natural. We don't want chemicals, we want natural. So one of the natural things that's going around now is raw milk.
Oh, boy.
Which is great because, you know, before this latest fad in Texas, I hadn't seen a case of brucellosis, which is not a fatal disease usually, but it's quite an unpleasant disease, and it costs a lot of money because it's a prolonged fever and you do a lot of tests. So I think that the educated, and I'm calling you all educated, I don't care whether you got a college degree or not, that you're here because you care about the topic, that we need to spread the news that, you know, I don't want to take care of sick children. I don't want to take care of children who are going to die. And I particularly don't want them to die of a preventable disease. So we do all these things for ourselves, screening for this. One of the great things about aging is you just look up preventative health, things you have to have done when you're feeling fine. You age out of certain things, and it's like, yes, there's something good that I won't have to have done this year. But I think people need to talk to their neighbors, their friends. They need to stand up for what science is, and we don't see these diseases anymore. But more and more young people are going, especially ones in college, and the millennials are going overseas. They're seeing these diseases. I am very hopeful that in the future we will have more people aware of the bad diseases and the good that vaccines do. So sorry for the California speech.
And I always like to say, death is natural, critical care is unnatural. So if you want to go natural, be my guest. Yeah. But kind of expanding on what Dr. Baker said, do you think it's ethical then for pediatricians to decline to care for a child whose parents refuse to have them vaccinated according to the CDC or American Academy of Pediatrics recommendations?
So the Academy, just heads up, the American Academy of Pediatrics is discussing their current guideline, which is you can't fire families. You can't say, I don't want unvaccinated children in my waiting room. So that discussion is out there among the experts, the people who know the science. I live in a different world. I can take the time and do the work. I think people out there struggling with their 10-minute slot for a well child visit are having a very hard time. And so this battle is going to go on no matter what policy is, unless it's a law and you're in violation of the law, physicians will refuse to take care of vaccine-refusing families. They don't want to take the time, they don't want to expose their other patients, and unless you have fever and a rash and they know to bring you in the back way, some offices don't have a back way and you are exposing others. And that, you know, that's why the Disneyland measles epidemic spread so well, is we had a lot of susceptible people out there and they traveled back to wherever they came from. And so people need to know that these are dangerous diseases. The media, I think, and both the legal people and the media, I thought did a better job of talking about our obligation to our neighbors as well as to our own families with the measles outbreak than I've seen in a long time. I don't know what others think about that.
You know, one thing, I've watched my wife go through this, who's in general practice pediatrics, and she initially just did the best she could. She tried the best she could to get kids to get vaccinated. She felt she was about 25% successful at getting those who really didn't want to get vaccinated. And then she drew a line. I mean, she said basically, let me love your child. Don't put me in a position where I have to practice substandard care. Don't put me in a position where I'm sending them out of this office where there's a greater risk of measles or mumps or whooping cough. Please don't put me in that position. And she was much more successful by drawing that line. Because frankly, when you continue to see people that are unvaccinated or undervaccinated, at some level you're tacitly agreeing that it's okay. And she finds that when she draws a line, and people see how important it is to her, that she's willing to actually lose them as a patient, they actually are more responsive. So I think there's something to be said for drawing a line. But again, it depends on the population and sort of what the educational or what the issues are for that population. I think different things would work differently.
Yeah, the personalities, you all know, I'm an internist, so I don't face this directly, but I know that there are colleagues, pediatric colleagues in my neck of the woods, who have this conversation with all new parents on the front end. And they just say, in our practice, we immunize children according to the schedule recommended by the American Academy of Pediatrics. You're in or not? If not, I'm happy to refer you to colleagues in town. And so they kind of avoid, they don't fire folks, but you have to pass that test before you get in.
And then their health insurance doesn't cover the referral. More and more people are losing their primary care providers, and I'm talking about the middle class, working families. It's a problem. The great news is vaccines are quote unquote free. Nothing's free, but we have programs to pay for them, and about a little more than half of children are eligible for the Vaccines for Children's program through the government, and CDC cost shares that. We, the taxpayer, boy, I'd love to spend more of my tax money vaccinating children and adolescents, even adults. I'm happy to make them be healthy too. But it's more and more of a problem in our community, and I'm certain in many communities with health insurance prices going up, people can't afford the co-pays, and they're losing their primary care provider, so they have to hunt around for another one. And it's a little more complicated. But remember, you can always go to the health department and get vaccines.
Yeah, go, Art, because Paul said this, he posed it as an ethical question.
Yeah.
Is it?
And I think it's an issue of what works more than it is an issue of principle. So I think we did a survey and found that about 15% of pediatricians were drawing the line. But it's a minority. It's not anything close to a majority. Most want to work with the families. I don't know that we've really studied whether those who draw the line do better and convert more folks. That would be the trigger for me in terms of, whether it's a good thing to do or not. But I want to switch gears slightly from that issue to something else. I don't think we're going to win the battle against hesitators and vaccine resistors by facts. The issue becomes one of ethics. And you need to have ethics in a couple of ways. One is, we've said this a few times, but I just want to underline it. If you offer people a choice, would you like to get stuck by a needle or not? They generally say, I don't know, maybe not. If you say this is what's going to happen, pause, see if anybody has any objections, we move forward. So we know, I work a lot in organ donation. If you ask people, would you like to donate your organs when you die? They don't do it as much as if you say, most people donate their organs, any reason you don't want to. We call it presumptivity. It's a moral shift. And you all are exposed to it too, because people call you up and say, would you like to donate money to your old alma mater? Or, how much should I put you down for? 1,000? 2,000? So you might say, well, it's 1,000, okay. But that's the way they extract contributions out of you, is to presume you're going to do it. So morally, I like presuming that we're going to do it and laying out that as the default. Informed consent doesn't require you to give people options. They can still say no. You can refuse to give anything to your old alma mater. But I like shifting the presumptivity default. The other thing I was going to say is, we mentioned it briefly, but you got to highlight it. Vaccination is almost always about the community.
Yeah.
It's almost always about your neighbors. It's almost always about protecting the vulnerable kid, the vulnerable older person, the person who's immune suppressed, blah, 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 blah. But we make it out like it's just your choice. That's very American. We're individualistic, we're autonomous, and I didn't even get to Texas yet. But, so you've got to stress, I think, that you do this because you're not a jerk. You don't put kids at risk, you don't put other people at risk, you do the right thing. I would add the facts into that ethical commentary that the right thing to do is to be a good member of your community. And you're not if you don't vaccinate.
That does nothing for the entrenched anti-vaccine person.
Those
Because they
guys,
don't care about
you know,
their
those guys you
community.
won't win anyway, but I'll take the wafflers.
Yeah.
Right.
I think, I mean, I agree that it does nothing for the extremists, and I agree that they're not our target, but I think it is important to emphasize to everyone that you're getting a 2-4. You are protecting your child and the community, because people do care about their child first and foremost, and they should. The fact that vaccines both are the lesser risk for this child and help the community is something I think we should emphasize, not just the community factor.
Well, I have a legal question. So one of the great accomplishments of vaccines is we do have lots of vaccinated young children and even lots of vaccinated adolescents. Needs to be better. But from a legal point of view, we have laws. And one of the reactions that California had to the Disneyland, and let me tell you, it was because the Land of Dreams was the source of something bad for people. From a legal point of view, we do have laws, and California now has a very strong law. Of course, they're trying to get a referendum against the law, but people can say no to the laws. So, you know, do we have more and more mandates, more and more laws?
So you're asking what can we legislate next, or what should we legislate next? Those are somewhat different questions. By the way, on SB 277, the referendum failed. Right now they're gearing up for lawsuits. So we can certainly go further than school immunization mandates. For example, France and Italy have criminal laws for certain vaccines, and it would be almost certainly constitutional to have them here. Should we do that? That's a very different question.
Right.
School immunization mandates are extremely effective. Once the exemptions are tightened or removed, I think they do the job reasonably well without much more. Of course, it's a battle to get exemptions removed or tightened. I don't think we need to go much further than that, and going further would be a political battle and an ethical question, which I hope that you'll address. So we can go further. I don't think we should, but we have a lot to do in the US in terms of tightening exemptions law right now. Texas has had a battle last year over 9 different statutes, all of which failed, if I'm not mistaken. And it has a very wide open exemptions. So school immunization requirements work well. They're a good choice in the sense that they're less coercive, for example, than direct criminalization. They leave people a choice. You can not vaccinate, you can't force that risk on other kids. But we have a lot to do in relation to them too.
So just to, oh, go ahead.
No, go on.
So the mandate issue, I think, is an interesting one. I've been a big proponent of mandates. I pushed hard to get the healthcare worker mandate through for flu shots, daycare mandates for daycare workers. And I think part of the issue is setting a good example. So it's not like every healthcare worker gets vaccinated or doesn't say, I don't want to be vaccinated. And when you see that, it is troubling because it starts to undermine. So I would say I favor mandates in a lot of settings, and I think they ought to be enforced. But the way you do it is by making it perhaps a little tougher to get the exemption. So if you just sign a piece of paper and say, I'm out of here, that's a pretty easy exemption. If you say you got to get it notarized, you have to listen to a tape with Paul Offit, you must meet personally with Bill Schaffner in order to get an exemption, then I think and there's no reason why you can't make exemptions from simple to moderately. You got to be serious about this. We've been doing a study. We have a big vaccine project running at NYU now. We looked at all the religions. There are 2 or 3 tiny religions that have any problem with vaccines, but a lot of states have religious exemptions. Why? Since religions don't oppose vaccines, most of them had concluded many of their holy books before vaccines appeared, so they don't have much to say, and most of them will come out and say they're for it. The Catholic Church or the archdioceses around the country have been taking pro-vaccine positions, basically, by the way, on the communitarian argument that you have to protect the community. All the Protestant groups, all the Jewish groups, all the Islam groups, Buddhism, Hinduism. So what's with the religious exemption? It makes it sound like there's some basis in the Bible or somewhere that you shouldn't vaccinate. And I don't think that's true. There may be philosophical objections or personal beliefs, but I'm not in favor of permitting religious objections unless you can come in and show me what religion says that you shouldn't vaccinate.
I have 2 points on that. The first is that in terms of mandates, I think our approach to exemption should be different between employees, and you're referring to the healthcare and the childcare settings, and children. Employees in these are areas that are heavily regulated to start with. You go into that, you go knowing that you're going to be regulated hand and foot. And there are areas where you're taking on responsibilities for a vulnerable population. You're entering a service profession. I think it's completely justified to require vaccination with nothing but medical exemption in the work context.
Even in the industries, hospital worker, daycare worker, I want them vaccinated, but I want them to wear big pins and buttons and hats that say I got vaccinated. In other words, they're the role models. Let's show it off.
You want to normalize it.
Yes.
My friend Karen Ayers says, if every parent that got their child vaccinated would say it, making it clear that that's the norm, it would make a big difference regardless of any law or anything. For school, it's a little different because we want children to be educated, and it's a more universal thing. There's not as good an out. I think it makes more sense to have an out from a school immunization requirement than from the employment. The other point in terms of religion is, I completely agree with you that most religions don't require it. I think if you have the religious exemption, people are going to lie to get it. But I would point out that constitutionally, we can't limit it to organized religion because that's considered discrimination against people who have as sincere beliefs but aren't part of an organized religion. So you have
I'd like to see them write down, I have a sincere cuckoo religious belief.
It's been done. New York that's what happens in New York.
You know, Doreen, can I pick up on something you said earlier? The true story, this all happened within the last month or a year or so in our hospitals. As a child who was seen at 2, 4, and 6 months of age, whose parents had recently converted to the Muslim faith. Now, they'd vaccinated their older child, but now they said that because of their faith, they weren't going to vaccinate. Now, there's nothing in the Muslim religion that says don't get vaccinated, but that's what they said. And so this child was seen in our hospital, in our outpatient clinics, where at 2, 4, and 6 months of age didn't get a vaccine. At 11 months of age, got pneumococcal meningitis with a serotype that was contained in PCV13 that could have been prevented, and had a bad case of meningitis, so bad that the child herniated, which is to say brain pressed down on brainstem, the child stopped breathing. We saved that child's life, but that child will never see or walk or hear or speak again because the parent had this false notion that somewhere in the Muslim religion it says you shouldn't be vaccinated, and we, out of quote-unquote respect for religion, stood back and let it happen. Who represents the child there? The child has rights too. Who represents the child if not the state?
I completely agree, and I think religious exemptions are unwarranted, unjustified, not just because most people lie about the reasons being religious, but because the fact that you have a belief isn't a reason to give up your child's interest. But you can't base it on only organized religion.
You know, it does lead to the question, where are the religious voices around vaccination, though?
Often silent. But let me put a little bit of this into perspective. Not that anyone here likes mandates.
Well, I like them.
Well, I do too, but as you said,
I like them.
and you know I do too. But as you said, and as was said before, Americans have an aversion to them, for starters.
Let's call them something else.
So hold on just a second. Hold on just a second. Hold on. So we think about the government imposing this on us. I'd like to suggest to everyone, actually, that the imposition of laws, the passage of these laws, was the epitome of American democracy. Because these are not federal laws enacted by a distant Congress in Washington. Each state had to enact a law that was, in effect, no shots, no school. In each 50 times, this issue had to come before the American people in a governmental forum at the state level, which was close to the people, and had to be debated in each state except one, and I always forget, Nevada or Nebraska. One of those end states has a unicameral legislature. Nebraska, thank you. So 99 times this was debated in a body of our elected representatives and was passed 99 times and was sent then to the governors of those 50 states who represented the entire spectrum of political thought here in the United States, and those governors all signed. If that's not the epitome of American democracy, providing legislation for the protection of our children, I don't know what is. So I think that that's actually a superb example of the voice of the people working for the benefit of our children.
So if I can redirect things for a second, what about then the media? I mean, we've I think sort of we know that the media tends to kind of sensationalize all the anti-vaccine stuff. What about their responsibility to present a pro-vaccine point of view or the benefits? Because I can't think of the last time I saw a show that actually said, hey, that HPV vaccine is a great thing, and we're going to focus on it on tonight's show.
But I think that scientists are at a distinct disadvantage in the media because you have the crying mom who is not bound by any scientific ethics regarding the null hypothesis or anything, who says, my child had this vaccine, the light left his eyes, and the next morning he was autistic. And then they turn to the scientist who can't say, in response to the interview's question that vaccines don't cause autism, but instead is forced to say something like, the preponderance of the evidence doesn't support a relationship between vaccines and autism, which is not an answer that instills confidence in parents.
Sorry, just one thing. I was that show you're referring to, which was an Oprah interview, Jenny McCarthy, and she said, he got the shot. And this whole. I was actually asked to be on that show, and here's why you don't go on that show. I mean, Oprah is there to tell a story. I mean, her story has 3 roles to play. There's the hero, the victim, and the villain. Jenny's the hero. Her son is the victim. This leaves only one role for you.
That's right.
So you don't go
That's
on that
exactly
show.
right.
I think that when you choose to enter that media event where there's the pro-vaccine person, the anti-vaccine person, 5 minutes into it, nobody knows who the expert is. They remember the fight far more than the facts, and I don't think you communicate science well there. I think you can't. It's a losing game. I think that's why I choose not to do that. I'll follow. I quote unquote debated David Kirby, but it was only after I followed him. I wasn't going to have the same platform.
I mean,
with
I
him.
think that's part of the trick, is to make scientists and doctors a little more media savvy.
That's
You
right.
never debate the mother. You're not going to win that. Even Marco Rubio doesn't think you can win that. He thinks you're going to have to
The point I'm
yield.
trying to make is a little different.
Correct.
Well, it's a
Don't
little
debate it.
bit closer to Holocaust denialism.
Right, I agree.
It's sort
Creationism,
of where
that's
we
right.
having this debate, quote unquote. But people do tell stories. I do think it's important to do better media training so that you're not stuck in situations where you're trying to debate somebody's direct firsthand experience, whether it's contingent, accidental, or just circumstantial. You don't want to debate mothers. The other thing we don't do very well is, you said, well, how many times does somebody put on a pro-vaccine story? Well, not often, although not never. I've seen a few. But you can write your own op-eds. You can send out your own articles. I try to do that. I try to periodically say, here's some positive thing about this, or here's something there. You don't have to wait to be asked. We could be proactive more.
I think the media is better
I agree with that.
in the last 2 years. I think they're more
This
responsible,
tenure.
more balanced. I'm complaining because the average pediatrician or internist has 10 minutes for a visit, and you want to have them go get media trained? Excuse me.
Well, some, not everyone.
The fight The battle is being fought, one family, one physician, one health center. That's why we're doing as well as we are. We're talking about the minority and strategies against the minority. So I have the solution. Every study published in the last 5 years, when you look at vaccine refusers, I'm not talking about, well, hesitants, most of them we can talk into coming to terms, but refusers. We'll just get rid of all the whites in the United States because Houston is the most diverse city in the entire United States. There's 7 Asian languages spoken in that city. I've been a minority for more than 20 years in the city of Houston. The majority is, we call Hispanic. That is not a race or an ethnicity, that is a political designation. But a lot of them are from Central, South America, Mexico. Guess who wants to get vaccinated the most? Immigrants.
That's what made Donald Trump's comment about bringing disease here so funny. They're at risk when they come here.
Immigrants.
Have better vaccination rates in Mexico.
It is the well-educated, in terms of pieces of paper that they put on their wall, people that have been here a long time, and it's very unfortunate. But I think we need not lose the big picture. The big picture is that there are physicians out there and family practitioners, pediatricians, internists, talking one-on-one with either the older child. I don't know when a child stops being a child. For me, I was 30. I wrote my mother and said, today I'm a grown-up. They'd already given me an MD degree by then, so it's a good thing I was grown up. But I think that we need to do things as an articulate, media-trained group to encourage that conversation and encourage our healthcare system to value what vaccines do. Give people enough time to talk to individual families. Most hesitant people, it's absolutely right. Somebody said it earlier. Some families are having a prenatal visit, so when they go see their OB, they find a pediatrician, and that's the time to start talking about vaccines. But this war is being fought one-on-one with individual families, and we need to support those policies that give healthcare providers, nurses. I mean, nurses are really, really important. They're the ones that are probably giving the shots. And if they're not on board with accepting vaccines in your office, do you think that they're going to be supportive of you recommending a vaccine, even if it's very strong? No, you have to have your whole practice situation on board.
I think I'd just like to throw out one other last kind of thought. So it sounds like, Carol's kind of saying healthcare, it kind of falls upon healthcare to try to change the mindset of these parents that really refusing vaccines. Does the panel have any other comments or thoughts in terms of who else might be a good resource, or who else should be really responsible for changing these parents' minds?
Other parents. I mean, the natural resource. The people talk to most are other parents and communities. Mm-hmm. Again, when Mark Zuckerberg put up a photo saying, I vaccinated my child, it's generated an enormous debate.
Yes.
If each of us, when we actually vaccinate, say that, put it in the open, since over 90% of parents do get most vaccines, I think it could make a big difference.
So, Paul, if you want a thought outside of the narrow medical box, some of us have looked very briefly, I don't want to dignify it as a survey, at the curriculum in middle and high schools that deal with vaccine-preventable diseases and vaccines. First of all, it varies enormously, but for the most part, it's very modest. Now, I learned a lot when I was in middle school and high school, and there are undoubtedly many other health issues that are being taught. But if I had a magic wand, I would create a new curriculum for middle and high school kids in the health curriculum that taught a little bit about the vaccine-preventable diseases and what a vaccine is and how it works and how you have to be thoughtful about it and accepting once you have a child yourself. I think that might help, but that's a big task.
Start younger,
I could give you 3.
where their brains get mixed up.
I can give you 3 strategies, although Carol did put me in mind of saying you can't stay in the basement anymore until you get vaccinated, but that's a separate for adolescents who won't grow up. So I do think the religious community should be used more and brought into this battle. I think most of them are very vaccine supportive and they need to be heard. I never hear from them. I never hear them talking anywhere, in any forum, any place. And I think they have moral authority. I think it's also important to try and work, if you will, with business. I was always hoping that Disneyland would have something that said, you can't go on this ride if you're below this height, and over here you can't go on this ride if you're not vaccinated. So there are things to do with industry and business that would set messages out. Our workforce is 100% vaccinated. It's not a message I mind hearing particularly much. And when I talked about media training, I didn't mean to go on national television. What I was trying to say is you should be able to stand up at your high school assembly or in your church or at your Kiwanis club or wherever you are and say, you know, I'm a pediatrician or I'm a doctor or I'm a pharmacist or whatever, and I think vaccines are important and here's why. You don't get that much. You just don't get it much.
And one last thought that we know this, and I think Paul has dealt a lot with this. Those online forums, those websites that just sit there and when you pull up vaccine safety, those are the sites that come up, the first 100 sites. We don't see the CDC, we don't see any of those others. They all come up, and that's what parents are going to see. So how can we kind of respond to this, or how can we address this issue? I mean, they have the right to say this, but do we have any kind of way of fighting back?
You know who fights back more than anybody else on this panel? Dorit.
Yes.
Right.
Some things are done. Google has changed its search engine, and that's improved it. The other thing you can do to really help is a lot of the search rankings are depending on links. So if you start linking from your site, and I know several of you do that, to the stronger sites, that's a big help. Other than that, we're kind of outnumbered in social media, but that doesn't mean there isn't a lot to do. There's a lot of great resources out there. They can be and should be shared. And again, speak up in social media just as much as you'd speak up anywhere.
All right. All right, I'd like to thank the panel for this discussion, and I'd like to open it up to the audience for questions. I guess I'll start in the back.
Yeah, hi, my name is Jim Luce. I head a small family foundation here in New York, and I have a column in the Huffington Post. And I just want to say this is one of the more inspirational and brilliant panels I've heard in years. I'm absolutely impressed. And if any of you would like to get your message out to lay audience, I'd be happy to work with you and publish in our weekly column to just push out this message, not in medical journals, but to the general public. I think it's enormously important. And I was just really, really appreciative of the words. Thank you.
Yes.
They can also subvert mandates because of charter schools, private schools, and homeschool. So you can't get at them that way. But I think a couple of times the idea of normative behavior has come up during this, and maybe it's time to bring in the social scientists because God knows science hasn't worked on them, and maybe it's convincing them that they are a jerk if they don't do it, and that other people whom they respect do it. But it seems to be really, they're almost impenetrable. And they're not associated religiously. They're not even, it's a point where the right and left converge. It's not political. It's a peculiar sectarian ideology.
Yeah. Stronger than religion.
It's a cult. Yeah. Yes.
Hi, good afternoon. My name is Maria Colasante. I'm a public health nurse over in New Jersey. I perform immunization audits, and I've also worked with pediatrics for many years. My question is, legally, would it be possible to go to the insurance companies? Now, they cover vaccines. If a parent refuses to have vaccine, would they be willing to not cover the medical care for a child that develops pertussis or the ongoing care for that?
2 points on that. The first is that right now, no, and the reason is the Affordable Care Act. Under the Affordable Care Act, there are only certain things for which providers can refuse treatment, and not vaccination is not one of them. So you'd have to change the act, and that's going to be a whole political battle that I don't think is going to be undertaken for that alone. The second point is, I mean, I admit that I have some concerns about doing that, because what you're talking about is leaving the child who got the disease potentially without enough care or enough coverage of care, and that raises its own issues.
Yes.
Hi, I'm Peter Purdy, and my question is, thank you. My question is meningitis in particular is less frequently talked about or experienced in this country in terms of the number of cases than, let's say, chickenpox, measles, things that were ubiquitous, at least when I was growing up as a child. So when you talk about the anti-vaccine movement, is this all vaccines, or is also the fact that meningitis, I would say, has lower visibility than some of these others? Is that an issue that even goes beyond the anti-vaccine movement, that a lot of people don't really know about meningitis? It's not that highlighted, shall we say, in the public health scene, I don't believe.
Mary Beth, did you want to?
I'd like to comment about that, please. I'm Mary Beth Kosla-Petracco. I'm a pediatric nurse practitioner and the coordinator for child health for Suffolk County Department of Health Services. And my issue with this, because I do the same thing that you do, I do the AFIX visits as well. I had a mom call me yesterday and say, why is that school nurse forcing me to get a meningitis shot for my 16-year-old? My doctor just said she had it at 15 and she has to wait for 4 years. Well, I explained to her why the second shot was important, that we were following the practice guidelines of the CDC, and I said, I'm personally acquainted with a couple of moms who've lost their children to vaccine-preventable diseases, especially meningitis. I think it's really important. My own children are insisting that their babies get vaccinated. My colleagues are, and I think your child needs this, and I think making this mandatory for school is a great reminder to tell you that your child needs it too. Fine, I'm going to call my doctor and tell him I wanted it. So, we have to get our professionals educated as well. I've had physicians say to me, it's only a couple of kids, why am I going to bother? I said, if it's your child or the next one, how are you going to say something to the parent? If you say you knew this vaccine existed, but you didn't vaccinate. So we've got two sides of the coin to do here. And again, I want to say thank you very much to Dr. Baker for talking about the nurses, because it is us we are the ones doing the education. The physicians really don't have the time. So that's why we really have to make sure that we have the nurses educated so that they know the appropriate things to say to parents. Because a nurse, because we carry so much weight with our credibility, if a nurse appears in a mask, or if a nurse says, I'm not crazy about this, do you really think the parent is going to want to vaccinate? I'm on this kick with parents. You see a masked healthcare worker, you tell them you don't want them near your loved one or you either. I think it's our professional responsibility, especially as nurses, when we accept this role, that we need to do the right thing according to the science. Thank you.
Can I say something about meningitis? By the way, that was very good. Meningitis is a problem in that this is the National Meningitis Association gala tonight, and that was formed for meningococcal meningitis, a word that nobody can say, so they say meningitis. But we have pneumococcal meningitis. Paul mentioned a story, and we have Haemophilus influenza type B meningitis, who have been largely conquered by vaccination of young infants. But it's a very confusing term to parents. It's not confusing to this audience. This is not your average audience. So I don't think we hear much about it. If they die, the parents have lost a child, but you don't really learn about the disease. So I used to say that influenza should be a disease where you break out in green or purple spots, and we need to educate all sports people, because all these people are out one day with the stomach flu, which is, obviously influenza. I think that meningitis has become largely invisible, number one, because we have 2 great young child vaccines. And fortunately, meningococcal meningitis is on the downcline, both because of vaccination and the natural history. But if you go to certain countries in Africa, you can see it everywhere if it's meningococcal, because it has visible outside signs. It's just a hard thing to explain. When I take care of a child with bacterial meningitis, I have to sit down and talk to the family 3 or 4 times. I'm talking about college graduate. It's hard to get your hand around it. It's not like whooping cough where you cough for 3 months. It's not like measles where you have a bad disease and your eyes are all red and it's just more difficult.
I also think that when a disease is rare, people fear the vaccine more than the disease. But when a disease is rampant, people clamor for the vaccine. We saw that with Ebola. Why is there no vaccine? And I was saying to my colleagues, if there was a vaccine, people would protest. They don't want to. But they won't protest until Ebola is no longer as rampant. Same thing with Zika. People are saying, are we going to have a vaccine for Zika? I said, why don't you take the vaccines that we already have? Right? So, and then we also have an issue with pediatricians and other healthcare providers who are doing alternative schedules, who are telling families which vaccines are important and which ones aren't based on which are the most popular still in the population. So polio, for example, Bob Sear says you don't need to get the polio vaccine because no one gets polio anymore. We all know no one gets polio anymore because of the vaccine. So as someone said before, the vaccines are a victim of their own success.
But I think, sorry, I think that I completely agree with you to a point. The thing is, I think we don't really know where the real risks lie. I think frankly, when there was that Ebola case in New York City, you could have gotten more people in the city to get an Ebola vaccine, or in this country to get an Ebola vaccine, than you could to get an HPV vaccine, even though HPV is much more likely to kill you. So I don't think actually the line I loved, because I was actually in New York City when that happened, was somebody said, people need to realize that you're at greater risk of being married to Kim Kardashian than you are of dying from Ebola in the United States.
Hold that, because I'd like to respond to Mr. Purdy, and then I'll come back to this. Because there have been many truths said here, so here's an additional one to try on. Because I think the anti-vaccine people are actually very smart. And when you do bring up meningitis, epidemic meningitis, it has a fearsome reputation in the past, and you can bring that to the fore. To be against a vaccine that prevents such a fierce disease, that's a loser for them. So they don't go anywhere near meningococcal vaccine. They'll work on something else. Now, apropos of the question, I think it quickly becomes known that this disease is common in a university setting. And if then the University Health Service, with the help of the State Health Department and the CDC, organizes, first of all, education and response, you do generally get, in that circumstance, a very, very good response.
That's true.
Although a lot of schools do have entry requirements that you have a vaccine, and nobody does it.
Right.
Nobody enforces it, nobody looks, it's a mandate without teeth.
So some universities are moving towards enforcing that.
Are they?
Yeah,
Because we did it at NYU. I asked the classes, freshmen that I see, meningitis vaccine.
They're making it connected to enrollment.
Yep.
Yeah, that's what I think that's the way to go.
Yeah.
I'm all for that.
So it's being done.
I just can't get my own school to do it.
So let the audience get in here.
I'm Kirsten Fizzle. I have a 19-year-old daughter who is a freshman in college, and I have tried to get her a meningitis B vaccine. I'd rather her get it before there's an outbreak on campus. I've called no fewer than a dozen providers, including my state and county health departments. A lot of people I call don't even know what I'm talking about. I get put on hold, I get routed around. There is no evidence of a meningitis B vaccine anywhere, and I live in
You
the
just have to
suburbs.
send them on a summer abroad trip.
Exactly. I mean, I live in Washington, D.C., so it's not,
Send them down to Texas Children's Hospital.
so a flight to Texas
Our entire
Children.
practice organization, which takes care of 80% of the children in Houston, greater Houston population, 6 million, they're routinely stocking it.
But you're right. I mean, because we gave this a permissive or category B recommendation, because we said you can use it if you want, I think that subtly sent the message that maybe we weren't recommending it. And so there are many physicians that don't stock it. I mean, that's just true. I get that call all the time. What do I tell doctors? I tell them they should give it, is what I tell them. But that's me.
The problem is that in cities, and I think we all live in cities, you have to convince the medical director or whatever you name the person, the CEO, the medical director, that storing vaccines for the population is still a category B, still is an individual conversation with the physician, but you have it, it's either a yes, so come to Texas, seeing as somebody was slamming Texas. We have it and we're giving it, not routinely. I mean, it is a conversation, and I have to say candidly, we're not giving a lot because most of the time the parent has to bring up the conversation.
And most of the time the physician doesn't have the time for the conversation. I mean,
Right.
that's just true. My wife will see 40 patients a day. It's hard to have that conversation every time.
But you can't have a conversation if you don't have a vaccine.
That's for
Vaccines don't save lives. Being vaccinated saves lives. If it's on the shelf, it's not going to help you.
Anyone else on the audience? Up in the back?
You had asked about the universities and what they can do to help, for example, with the meningitis vaccine. And speaking in regard, there was somebody here from Princeton for the Philadelphia meeting, so many of you know the answers to this. But it was astonishing. They had a 98% turnout rate for the meningitis B vaccine for both shots, and that was produced by the students through social media. I mean, it was incredible, and it was obviously very successful. So in regard to what can be done on a college campus, you got to get the kids to peer pressure each other. And I also wanted to mention, I don't have a medical degree, I'm just a mom. I thought in order to go to a fine university, you needed to get all these vaccinations. I didn't think you could get in without them. So I never questioned my doctor. But on the same hand, with the multi-strain of meningitis, I did not know that my son could contract meningitis because I didn't know there was anything else like the B form. So I think it's really confusing to the public as a mom to know that there is another strain out there which is becoming more popular, and I cannot get that vaccine in Massachusetts. I've called, I can't get it for my other son, so.
Yeah, just one quick comment. So I was involved to some extent with the Princeton outbreak, which was a serogroup B outbreak. Best T-shirt, by the way, on campus, where you're right. They had like 90%, 98% immunization rates would have been meningitis A at Harvard.
I just had a question for the doctors.
It's coming.
I just had a question for the doctors, Lee, Baker, Schaffner, and Offit. Scientifically, it sounds like there's no repeatable, verifiable studies that have tied autism to vaccines. And so if that's the case, when people make the claims, what are they really basing them on in terms of, is it just emotion or irrationality? So are there any repeatable, verifiable studies that have been done that tie any of the vaccines to autism? Or is the only way to really remove this and put it to bed is to prove that autism is caused genetically, or to actually find a cause for it that's not related to vaccines?
Yeah, Allison said that earlier.
All of those things. I mean, I think we had the initial paper that hypothesized a link between MMR vaccine and autism back in 1999, which was since retracted and proven to be fraudulent and all those things. But I think once you put that scary idea in people's heads, it's very hard to get that scary idea out. So there was an association between the MMR vaccine and autism, to the extent that parents were saying, when their physician told them it was time to give their child MMR, people would say, oh, that's the autism shot, right? So we're fighting that. Then we're fighting what parents say they see before their very eyes, where they are applying causality where none really exists. They say, I gave my child the vaccine, and the next day he lost his words. What I often say is, children develop. We call it childhood development. There's one day when a child is crawling, and then one day, miraculously, a child takes his first step, right? And it's not because of what he had for breakfast that morning. It's because on that day, he was developmentally ready. And it's the same with autism. The signs of autism become more prominent as children get older. We tend to see them around the same times that we're giving the bulk of vaccines, around age 1. So parents are applying causality where we know, based on the science, that causality really doesn't exist. And then we also, unfortunately, have this culture of celebrity that reinforces these anecdotes, where high-profile celebrities who have access to the media share their anecdotes and are given unprecedented access, whereas scientists have to fight for that airtime to share the science. So I do think that about 5 years ago, we thought that once we had enough studies showing that there was no association between autism and vaccines, that we would be finished. But that has proven not to be the case. What families now say is, you cannot tell me vaccines don't cause autism until you can tell me what does cause autism. And that's why we're investing so heavily in the science of causation, to understand what are the genes underlying autism, what are the environmental triggers that work with those genes to cause autism. And we're learning more every day. We know that autism can be seen prenatally. We can see changes, we can see genetic changes prenatally, we see changes in brain structure prenatally. We are developing animal models that mimic the genetic deletions and associations that cause autism, and we're able, through treatment, to reverse those symptoms. So there's a tremendous amount of hope. I think I've been in this field for a long time, and I am more hopeful now about our ability to understand the causes of autism and to develop treatments that target the core symptoms of autism than at any time in the past. And I hope that once we are able to answer those questions with greater specificity, that the question of vaccines and autism will finally be put to bed.
They'll come up with something else.
Yeah.
We have to remember that you mentioned smallpox vaccine. So a very famous person in Philadelphia was against smallpox vaccine. His name was Benjamin Franklin. When his 4-year-old died, he changed his position. So I think we're always going to have anti-vaccine sentiment. What's different now is everything gets on the news and everybody everywhere knows what. I had no idea growing up in California what was going on in New York. I'm not sure I knew New York existed until we did geography and learned the states. So I think we live in a different time, but we're always going to have those people who want the right to think and say things that scientifically aren't true. So the battle needs to keep going, and I'm very hopeful that the media seems better. Instead of having, and I'm sorry if I'm offensive, soft-spoken, gentle, kind, gray-haired old men speaking statistics against beautiful Jenny McCarthy and her tears and everything. I mean, that's not a debate. You're right, Paul, that guy's the villain. It could be a woman. She's going to be the villain because, we've got this celebrity. But I'm very hopeful for the future, but we're not going to have to just put our fighting tools away. I think we need to refine them more and more. The college campuses, that was the number one thing was normative behavior. Talk about the good things that can happen from peer pressure. That is an example on all the college campus outbreaks. They've had really, really high responses.
I have an interesting blend of, I guess, old and new technology, so I got this sent to me as a note. But apparently from Facebook, somebody was following this and actually threw out a question that they wanted to ask the panel, which is, what can we do to spread awareness?
The best we can.
Well, if you're on Facebook, share stuff that's positive.
Right.
Now.
I think we have time for one final question. Two final questions.
Speaking of Facebook. Hello. Speaking of Facebook, I think that's my cue. I'm Melody Butler from Nurses Who Vaccinate. And it's really important that everyone here, if you are on social media, you make use of that. If you are in the PTA, that's your speaking voice. If you have a child in school, that's your opportunity. There's no way anyone should go home today without speaking about what you saw here, what you heard here, and what you plan to accomplish. As nurses, we have a responsibility to be educating in our community, workplace, and on social media. I give much commends to all the healthcare professionals who are out there on the front lines on Twitter, Facebook, and I myself am there as well, but we need to make sure the parents are there, because as much as I may come in as a nurse and try to relate to you, the parents are going to listen to each other, and you all need to share your stories, share your fears, share why you vaccinate and why it's important to you. Thank you.
And we'll let you have the final word.
Thank you. This has been a great discussion. I just wanted to reference back to something Lynn Bozoff has said at the beginning, where she mentioned that less than 30% rate for the MenACWY booster dose among 16-year-olds, and what you think, you might explain that low rate and what can be done to get it up in that older adolescent group.
Well, I know that 50% of girls who are 15 and above leave their pediatricians because gynecologic issues come up and their parents want them, usually their mother want them to go to an OB-GYN. That's like getting vaccinated by a surgeon. We're doing better getting OB-GYNs to vaccinate pregnant women for flu, barely, this much better. So that's part of the problem. The other thing is they become more and more autonomous. We've been having annual visits, annual visits, annual visits. Let me tell you, for all the battles you have to have with your teenager, the annual visit is something that you may start dropping when they get to be 15, 16, 17. They just don't want to go in. They're healthy. So it's a real problem. It's an access to care, but it's not that the care isn't there. It's that, so we need to get these teenagers involved in some other mechanism. But it's an effort. I've spent my entire career, which is getting to be pretty long, talking to obstetricians about doing good things to pregnant women and girls, right, preventative health care, et cetera. And I think Bill would agree, this is a new group of people who need to vaccinate as one of their preventive care things. It needs to be normative behavior. So when you're a pregnant woman, you go in to find out whether to confirm you're pregnant and everything's okay. They draw a ton of blood from you. They take urine from you. They then do a glucose tolerance test. How many men have had a glucose tolerance test? It is not fun. I mean, it's not a fatal experience. So doing something like vaccinating somebody, putting a needle in their arm, is like nothing compared to all the other things that are going on in pregnancy. But it's a problem of, Bill said, education. Maybe we need to start in 5th and 6th grade learning about vaccines, and some of that information will stay for the people that go to OB-GYN and then start vaccinating their patients too. It's a problem. This is a broad education problem.
Well, with that, I'm going to end the discussion. I'd like to thank NMA. I'd like to thank our panel, Carol, Dorit, Art, Bill, Allison, Paul, Mark. And I'd like to thank you all for participating and asking questions. Thank you.